Okay, chapter 31 on sulfonamides. This is probably my shortest PowerPoint ever. It's including the cover slide here. I think it's 3 slides. This chapter is only a couple of pages. But here we go, sulfonamides. So the sulfonamides, interestingly, are one of the oldest antibacterials made from a coal tar derivative in the 1900s, and it was the first group of drugs used against bacteria. I just thought that was interesting history. It's not classified as an antibiotic. It is a bacteriostatic because it inhibits bacterial synthesis. So in inhibiting it, it is one of those ones that I mentioned in the previous presentation, that it inhibits bacterial synthesis of folic acid, which your bacteria needs to grow. So if the bacteria cannot synthesize folic acid, the bacteria cannot grow. So it doesn't kill bacteria, so it's not an antibiotic, but it is an anti-infective. Humans don't synthesize folic acid, that we have to get it from our food or a supplement. So by it inhibiting the synthesis of folic acid for the bacteria, it does not hurt the human being. You will see this used in a combination, as I put the pictures here, Septra DS. It's trimethoprim and sulfamethoprine, or you'll see it listed other ways. We'll get into that in a minute. It can be used an alternative to somebody that's allergic to penicillins. It is most often used for urinary tract infections and ear infections. 90% effective against E. coli. And E. coli, as I mentioned previously, is the most common cause of urinary tract infections because of the location of the rectum, and E. coli being in our stools. So it is a preferred treatment for urinary tract infections caused by E. coli. It does cross over the blood-brain barrier, so it can be used for meningococcal meningitis. It's not effective against viruses and fungi. It is not an antifungal. It is not an antiviral. It is a bacteriostatic anti-infective. It's very easily absorbed in the GI tract and into the tissue and into the brain. That's why it's good for meningitis. It's metabolized in the liver and excreted by the kidney. So what do you think you're looking for? You're obviously looking at liver function, kidney function prior to use and during use. Because it's readily absorbed in the GI tract, it is most often given orally. You will see it in ointments. The most common is an ophthalmic use. You'll see used in babies as a preventive measure when they're first born, and silver sulfadazine, which commonly known as Silvadine, but it's silver sulfadazine. That's the generic that's used to protect against bacterial growth, a prophylactic and prevent bacterial growth in burns. Very highly protein bound. So if somebody has low protein stores, like an elderly, you might need a lower dose, because if it's not bound to the protein, it is free. So they have more circulating in the body. That's something to keep in mind when you're looking at the Septra versus the Septra DS over here. They now do the intermediate acting, so that it has a longer half-life. The half-life of 8 to 12 hours. Because of a half-life in 8 to 12 hours, you'll see it administered twice a day, because once a day does not keep the therapeutic levels in the body. Poorly soluble in urine, so it can cause some crystals, and I have a couple pictures on the next slide to help with some of these side effects and things to remember. Table 31.2 in the bottom of page 430 goes over the different ones. Focus on the trimethoprim, sulfamethoxazole, because Bactrim Septra is what you'll see them listed as, or it'll be TMS or Bactrim DS, which is the double strength. If you look on your things here,
The single strength is 80 milligrams of trimethoprim, 400 of the sulfonazole, and you see here it's exactly double over here. So what is this with this trimethoprim? Why is that combined? It's combined because it helps prevent a bacterial resistance to the sulfonamide drug, and you get a better response. I'm going to go here to this next little slide, and very last slide of this entire presentation. So combining it, they have a synergistic effect. Remember, I said additive is 1 + 1 = 2, synergistic is 1 + 1 = 3, 1 + 1 each individually. When you combine them, they work even better than each individual combination. So it is a synergistic effect, increasing the drug response. The trimethoprim can be used for urinary tract anti-infectives, so this combination just increases the effect. Used for treating urinary, intestinal, lower respiratory infections, otitis media, prostatitis, and gonorrhea. So there's one with gonorrhea that can be used. I did that so you'd remember the synergistic. I put over here to remember the crystallization in the urine. The NUR intermediate acting has less chance of crystallizing, but still I wanted you to see what crystals in the urine look like to realize the urinary tract damage and the stones that can be formed if urine is crystallizing. So what does that mean? As a nurse, you are going to tell them to take each dose with at least 8 ounces of water and have a large water intake through the day. This is a potential side effect, erythema multiforme. I wanted you to see exactly what that looks like. That's a lot better than just hearing a description. Another thing, couldn't find a good picture for, we're looking for blood dyscrasias that can cause iron and bleeding and other problems. So of course, warfarin is one of those drugs, just like so many, that there's a bad interaction and it can increase the anticoagulant effects of it. Another big sensitivity or interaction is with drugs. There's sulfonylureas that you're used to lower blood sugar, and this potentiates the effect of those, and they'll drop the sugar even lower. Some other side effects, mostly it's the rash. You might have anorexia, nausea, vomiting, diarrhea, anything. I went over the others. It is very rare to have an anaphylactic reaction, but it's not impossible, because I think I told a story of my son having a reaction, but thankfully we were past the half-life. And that actually is a conclusion of chapter 31.